A study from the Center for Addiction and Mental Health finds that fewer Ontarians are drinking than before the pandemic. But rates of binge drinking, defined as having 5 or more drinks on a single occasion, haven't gone down. So, what's driving the disconnect? Dr. Dominique Morisano is a clinical psychologist and an adjunct professor at the University of Toronto. Dr. Morisano, great to have you on the show. According to the CAMH report, fewer adults in Ontario drank in the past year compared to before the pandemic. However, binge drinking still remains high. Help us understand that. What's the disconnect there?
Well, I think that, there are a number of reasons for this. It's, multifactorial. And, what I think while fewer people may be drinking overall, and, we've noticed a lot of trends with, dry January and things like that. It feels like more people are sober curious, but the people that are drinking, when they are drinking, they're drinking to get drunk. And I think that, increased economic difficulties, which we've seen, across the province, increases in stress, depression, and anxiety, have all been contributing factors to higher binge drinking rates.
Is there a distinction between a binge drinker and an alcoholic?
Yeah, there's a major difference between a binge drinker and an alcoholic. And in fact, like in general, I try not to use terms that define people by a
Hmm.
problem that they have. So, people who binge drink, because we're so much more than that in general, right? Whatever we may be doing in
Mhm.
our daily life. But, when people have alcohol use disorder, which some people call alcoholism, it's a chronic condition that, requires that really moves people to have to drink on the regular, right? Daily, maybe multiple times during a day. And binge drinking is more of a behavior pattern where for women, it's drinking 4 or more drinks at any given time. And for men, it's drinking 5 or more drinks at any given time.
I
Yeah.
think viewers and listeners might be surprised that when we hear sort of the definition of 5 drinks or 4 drinks, that would be, classified as someone who would be a binge drinker. Is
Yeah.
that a shock to many people?
Um, I don't know. I don't know. I think everybody has different, what I call tipping points, and that's that, point where I talk about with my patients where someone loses control over the amount that they're drinking. They're not maybe making good decisions. Maybe their inhibitions are fully, dismantled. But the other thing is that people don't necessarily know what a standard drink is, and people are often surprised that a full pint in Ontario, which is about 20 ounces, is not a drink. That's more like a drink and a half. That a 12-ounce beer is a standard drink, or like a 1.5 ounce of hard alcohol, or 5 ounces of wine. Sometimes they even have big glasses of wine. So really getting people to think about, what am I
Mhm.
actually drinking? It's 4 standard drinks for women, 5 standard drinks for men. Yeah.
You talked a little bit about sort of the factors. Help us understand more what actually makes someone likely to binge drink.
Yeah, I mean, I think, for many people, well, it depends on people's ages, right? I think young people often will binge drink, frankly, because of inexperience, not understanding how alcohol works, what their own limits are, how much is it going to take for them to get drunk, stay drunk, go beyond drunk to quite ill. And I think peer pressure has a big role to play in that. When people are like, "Come on, we're all drinking, another one. Like, let's do another shot, whatever." It's a lot of people don't have the self confidence, or, uh, you know, let's just say psychological strength to say, actually, I'm good. I'm good where I am. They want to kind of go along for the ride, and they aren't often thinking about the potential consequences that they may find themselves with later. Personality traits like an increased likelihood of impulsivity, sensation seeking, Low conscientiousness, which is a personality trait that's measured by something called the Big Five personality inventory. Sometimes high stress, obviously anxiety, depression. Genetic factors can play a role, like heritability, like if your parents, grandparents had issues with alcohol or risky drinking, it is more likely that um, the next generation will. Um, yeah, I would say those are the biggest factors at play. Yeah.
There might be people who even colleagues of ours when we first started talking about this story talked about what is that definition of binge drinking, being surprised, and probably with your definition of what a pint is might even surprise them a little bit more. But can you help lay out the risks associated with binge drinking, where some people might say or have this understanding that there is some control, that I do have control of this, but at what point does that teeter, or what are the risks overall with binge drinking?
Yeah, I mean, so the immediate risks of drinking too much, often, one of the most obvious ones is making poor decisions, right? So oftentimes people will do things or be uninhibited and make decisions, about behaviors, acts, acting out, maybe participating in unsafe sexual behaviors, unsafe activities with other people, violence. They may have unintentional injuries like falls, tripping, crashing cars. We know that that's a big one. Um, uh, we know that violent behavior can increase with drinking. And of course, there's alcohol poisoning, which is not uncommon and which can be fatal, which I think a lot of people don't know. So those are the behaviors of binge drinking itself, or the risks of binge drinking itself. And then I think chronic risks of continuing to binge drink over time are related to many of the risks associated with alcohol use disorder, like liver disease, cancer, high blood pressure, heart disease, and of course alcohol dependence.
I want to talk about access. As we know in Ontario, alcohol is now available at grocery stores, they're at your convenience store. How much does that add to the problem?
Well, yeah, actually, I've been working in the area of alcohol and public health, believe it or not, since I was a teenager. So for decades. And one of my mentors was a huge expert in alcohol policy. And I was talking with him about this yesterday, and he was saying this. There's no doubt that increasing access is linked to increased problems, and we know that the more availability people have to alcohol, the worse the problems are. This is, I think there's been hundreds of studies across many countries showing the link between ease of access and increased public health problems. And physical availability restrictions have been a basic part of comprehensive alcohol policy for a long time. We know that they can reduce rates of hazardous and harmful drinking when there are fewer places to buy alcohol, when the hours are reduced, when there are age limitations on drinking, and studies have shown that these restrictions have reduced motor vehicle related deaths, violent acts, even homicide rates.
On the flip side of this, we do know that alcohol is big money. The
Mhm.
LCBO, the Liquor Control Board of Ontario, is bringing in about $1.7 billion if we look at the 25-26 year. I'm curious, does that raise concerns that the province might be less motivated to deal with the harms related to alcohol, with the revenue being so lucrative?
I think if the I think if the politicians aren't looking at the costs involved, then yes, it would be impactful. Or if they're just looking at the headlines or the big numbers and not all of the other numbers that are related to alcohol harms, then they might get confused and think that this is a big win. But regarding revenues, from taxes, or from the LCBO, they don't come close to paying for the costs attributed to alcohol, from hospitalizations, premature deaths, criminal justice enforcement, social services for drinkers, and problems in work settings. I was looking up some statistics yesterday, and I saw something that said alcohol, beyond loss of life, alcohol is the most costly substance in Canada in terms of healthcare, law enforcement, and lost productivity. It measured the cost being about 20 billion in 2020 for Canada. So 1.7 billion, 20 billion across the country. They're not equivalent figures. And I think that, the revenues that might be lost to provinces, with, increased restrictions on availability, such as taking it out of grocery stores, corner stores, things like that, can easily be recouped by savings in healthcare costs, social services, and the fact that consumers are going to be spending more money in other parts of the economy. I have patients that have maxed out credit cards from alcohol purchases, but when they're not spending money on alcohol, they're actually spending money on education, on skills to help their own health, and that has that's obviously going to have a lot of benefits
Well,
when they're multiplied.
with that being said, Dr. Morisano, you work in the clinical space. So I do want to ask, what's one piece of advice for someone who is experiencing binge drinking and is concerned? What advice do you have for them?
Yeah, so first things first, the fact that someone is acknowledging that they have a problem is the most important point. So that's a good thing if someone says, I think I'm actually drinking too much, right? So someone can always talk to their primary care doctor about resources and brief interventions and things like that. In Ontario, there are a lot of alcohol-related services that are covered by OHIP. Connects Ontario, CONNEX Ontario, is a great resource for finding those places. And for my, patients that are concerned about actually going out, I always say, like, try to think about your limit. Try to think about your personal limit, for what's your tipping point, and stick to that limit. And I often suggest that people intersperse drinks with water. So if you have a drink, then have a glass of water and see how much you want the next drink. Having some accountability across friends, like, let's only drink this much tonight, or I'm only going to drink this much. Please help me stick to that. And then, seeking help when needed.
Dr. Morisano, we are going to have to leave it there, but thank you so much for your insights. Really thank you for it.
Yeah, appreciate being on.